Blood pressure medications are essential tools for millions who manage hypertension. But did you know that some medications come with far fewer side effects than others? Today, we're diving into the safest options for managing high blood pressure, focusing on drugs that keep your blood pressure under control without causing those pesky and sometimes serious side effects. If you're new to blood pressure meds or curious about switching to a gentler option, keep watching. And as always, before making any changes, talk with your healthcare provider. Let's start with the basics. Blood pressure medications work in different ways, and that's because blood pressure itself is influenced by many factors, from your blood vessels and heart to kidney function and beyond. Now, each medication has a unique approach, and some work a bit better for certain people or in certain situations. But when it comes to side effects, some classes of these medications are just kinder to the body overall. First off, let's look at the classes that may work but tend to bring along unwanted side effects. Central agonists, for example, are one type. These drugs work by targeting certain brain receptors to lower blood pressure. Sounds high-tech, right? But this class, often represented by the drug clonidine, is actually a bit unpredictable. If you're prescribed clonidine just for blood pressure, it may be time to ask why. This medication is generally kept as a backup option due to its wide-ranging side effects. Next, we have the alpha blockers. These meds work by blocking certain receptors, which helps to keep your blood pressure in check. Drugs like prazosin or doxazocin fall into this category. While effective for some, they're not usually a first pick for newly diagnosed hypertension due to the variety of side effects they can bring along. Then we have the loop diuretics, like furosemide. These cause you to flush out extra fluids, which can lower blood pressure, but they can mess with your body's electrolyte balance, making them less than ideal as a primary solution. Moving up in safety, let's talk about beta blockers. Medications like atenolol or metoprolol fit here. Beta blockers work well, but they're known for causing some unwanted changes like impacting blood sugar and, in some cases, even lowering testosterone. Unless prescribed by a specialist, it might be worth exploring other options. Then we have calcium channel blockers, which relax blood vessels to help blood flow more easily. Amlodipine, for instance, is in this group. They're more tolerable for many, but still may bring side effects, like swelling in the legs. So if this is the only medication you're on for high blood pressure, consider asking if there's a safer option. Now, we're getting into some of the safer options. Thiazide diuretics, like hydrochlorothiazide, are a better choice for many people. They help control blood pressure with generally fewer risks, but they can still impact electrolyte balance and blood sugar for some folks. Generally, though, they're a reliable second-line choice. Then we come to the ACE inhibitors. These are popular for good reason. Drugs like lisinopril and benazepril are widely prescribed because they work effectively while keeping side effects relatively low. If your doctor has you on an ACE inhibitor, it likely means they're aiming to keep you on a treatment plan with fewer long-term risks. And now, the class of blood pressure medication that tops the safety scale, ARBs, or angiotensin II receptor blockers. ARBs, like losartan or valsartan, work similarly to ACE inhibitors but are generally even gentler on the body. They're known for causing the fewest side effects, making them the go-to option for many people. In fact, recent studies show ARBs may outperform other drugs in keeping side effects at bay. And here's a tip. If you're concerned about costs, there are plenty of generic ARB options that work just as well. Medications are just one part of the story. Many people have successfully managed their blood pressure with lifestyle changes alone. A diet low in processed carbs and free from vegetable oils can make a big difference. And while some people may still need medication, even a single low-dose pill can often help keep blood pressure within a healthy range without major side effects. So if you're on a blood pressure medication and are curious about side effects or safer options, don't hesitate to talk with your healthcare provider. Whether it's about switching to an ACE inhibitor or the gentle ARBs, it's important to feel confident in your treatment plan. And remember, managing blood pressure is about more than just pills. It's about choosing options that work for you with the fewest risks possible.